California Governor Gavin Newsom, who stopped by the Moscone Center, which is one of our major vaccination sites. In this site, we have the ability to vaccinate at least 10,000 people a day. And Kaiser Permanente, who is partnered with the city on this site, they've been doing an incredible job. And in fact, they've been able to do almost 5,000 per day at this site alone. So we appreciate their work. I've been getting a lot of positive feedback. We know that it's not about the facilities and the physical structures and the logistics. It's about the supply, and the supply that comes from the federal government. And here to talk about our efforts throughout the state and what we're doing to make sure that when the supply comes, we're ready, is our Governor, Gavin Newsom.
Thank you. Let me thank the mayor. Let me thank Supervisor Haney as well for being here. I know Supervisor's district, and it's great for me to be back in my hometown, San Francisco, and to be with all of you, but also more importantly to celebrate the success of the mayor, current administration, the entire team, Dr. Colfax and Mary Ellen and others that made this site possible. This is one of the largest sites in the state of California. This is one of the most efficient and effective ways to quickly administer the vaccines, not only here in San Francisco, but here in the state of California. This is state-of-the-art, 22 minutes from beginning to the end, with a platform called My Turn, which now will be a standard platform all across the rest of the state in the upcoming week as we move from a pilot phase to a statewide application phase, notification phase, and reservation phase on one single platform. So San Francisco is leading in that respect, and they're partnering not only with the city and county, but also partnering with the state and our federal partners in terms of not only focusing on efficiency, but focusing on equity. One of the critical components of all our vaccination efforts is to make sure that we have equity front and center. Later this afternoon, the state will put out its demographics, basically a sum total of all local efforts, and it will show what we have been previewing for some time, that with the first allocation of vaccines predominantly going to healthcare workers, that is not truly representative of the demographics in the state. We have work to do as a state to do more and do better to reach out to our diverse communities. The mayor is doing it here in San Francisco, in Chinatown, Bayview Hunters Point, Western Addition, focusing on African American community, Latino community in the Mission, focusing on the Asian community in Chinatown. We need more of that effort exampled all across the rest of the state. The state is committed and resolved to do just that, but at the end of the day, localism is determinative. State's efforts are realized at the local level, the community-based level. Here's the good news. We're also realizing tremendous progress here in the state. We have seen a positivity rate that 1 month ago today was 13.5%. Today, it's 4.3%. In just 30 days, 13.5 to 4.3%. Literally, this time, the 12th of January, last month, we reported 36,000 cases here in the state of California. Today, 10,000 cases. 36,000 to 10,000 cases. 34% decline in hospitalizations the last 2 weeks, 29% decline in ICUs in the last 2 weeks. We have seen a tripling of vaccinations administered in just the last month. Let me be even more specific. As I speak, 5.5 million vaccines have been administered in the state of California. This time last week, it was a little over 4 million. We're now averaging roughly 200,000 vaccines being administered each and every day. That's double where we were a few weeks ago. What this site proves is that the only limitation in our capacity to do more is supply. And supply is the constraint. Supply is the issue here in the state of California, all across the country. Let me again be more specific about what I mean. This state, because of the Biden administration's leadership, has a 3-week window into our allocations, meaning we know what we're going to receive, not just this week, next week, and the week after. Here's the reality. 1,080,000 doses received last week. 1,080,000 doses received this week. Next week, we anticipate a modest increase, 1.2 million doses, not a substantial increase. And while the administration's done a very admirable job procuring more Pfizer and Moderna vaccines to the tune of 200+ million, those vaccines are not available until later in the summer, likely, as the administration announced yesterday, in July. So the challenge for us is not only to build out the infrastructure like we've built it out here, like the city has built it out here, that provides capacity. It's having the supply available. This is an example of what other cities are doing, large-scale sites down at Levi's Stadium, Oakland Coliseum, down at Petco Park in San Diego, larger sites that are now being stood up in partnership with the federal government, a new one focusing exclusively on equity into the African American community at Cal State LA in partnership with the Biden administration. Community clinics now getting direct allocations from the Biden administration, 500,000 across this nation going out next week. That will also help from an equity lens, but we have a lot more work to do. We need more supply. As soon as we get it, we'll be able to administer it. So good news, making progress on the dosing, administration of those doses, making progress in terms of the numbers moving in the right direction, allowing us a little more flexibility in terms of not only business reopenings, but school reopenings. And we need to get our schools reopened in the state of California for our youngest cohorts. We can do that safely. Our kindergarten students, our first and second graders first. We'll get our third, fourth, fifth, and sixth graders in as a second cohort. Our special needs kids, those foster kids, those kids that are homeless need to be in-person instruction safely. We could do that as a state, working with the legislature to support efforts at the local level to provide resources, $6.6 billion of resources to advance that cause, and we continue to make progress on that effort, but it's foundational. And finally, small businesses. I'll be down in Chinatown in just a moment talking to small businesses that are beneficiaries of the state grant program, amplifying the work the mayor and the supervisors are doing with their own grant programs. We're going to quadruple the amount of grants coming from the state of California, an additional $2 billion of grants, not loans, the state will be putting out very, very shortly. $5,000 to $25,000 grants to small businesses. The first round of grants that have gone out, 77% were focused to awardees in underserved communities, women, minority-owned businesses disproportionately. 5 again to $25,000 grants, also to nonprofits and cultural institutions. So small businesses, getting our schools safely reopened for our youngest kids, and getting these vaccines into people's arms, out of refrigerators and out of these warehouses all around the world and distributed here locally with equitable mindset. That's our prioritization. That's our focus. Final point. This variant, this is a thing that keeps our health folks up at night, Dr. Colfax, others. Issue of the variant is very real, particularly as it relates to the South African variant. As it was noted just a few days ago, we have sequenced about 13,700 isolates through our genomics. Well, we have labs up and down the state, but about 14,000 isolates have been sequenced. We currently have 186 UK variants that we have found in the state of California in 8 counties. We now have 2 South African cases in the Bay Area, specifically Alameda County and Santa Clara County. No Brazilian cases, and now we are over 1,800 cases of the West Coast variant. Again, the West Coast variant doesn't get as much attention as the other variants, but we also have an eye on that. But 2 South African variants have been identified, and now 186 of the UK variant. And so keeping an eye on that, it's foundational. The real progress is being made, and that's encouraging, and that should encourage all of us. There is light at the end of this tunnel, and we are very, very confident by the end of July, based upon the announcement of the Biden administration yesterday, we are going to be at scale in terms of accessibility and availability of these vaccines. I'll just end with this preview very, very briefly. We have a third-party agreement that we're working on with Blue Shield and with Kaiser. It will go into effect, the implementation will go into effect next week. Later this afternoon, our team will be socializing a lot of the terms of the contract. Later this afternoon, we'll be putting out the demographic data. Later this afternoon, we will also be advancing our efforts to be more inclusive to those with disabilities. And I want the disability community to know we've heard you, and we're going to do more and better to provide access, even with the scarcity, access to vaccines 16 to 64. And so we recognize those with IDD and others, physical, intellectual disabilities, uniquely vulnerable. And so we will be announcing more formally what we anticipate over the next 30 days in terms of achieving some results and making sure that we're prioritizing and allowing access for the special needs of our community leaders with IDDs.